When presented with a new case, paramedics must talk through the information received via the call centre. This will allow paramedics to briefly anticipate what to expect. In this case, two paramedics are en route to a 7-year-old child who has previously been diagnosed with high-functioning autism and has fallen during recess. Upon briefing the information received, paramedics can prepare to overcome clear barriers. This enables effective communication, which is essential to all patients, especially those with specific needs. What do you think the paramedics should do? A. Turn the ambulance in the opposite direction and go and get a coffee because you don't want to deal with a crying child? Or B. Talk about ways to execute this job in an efficient way. Given the situation, how would you respond?
Alright, so we've got a 7-year-old child who's been diagnosed with high-functioning autism. Unfortunately, there were no teachers present at the time of his accident. However, it's believed that he fell from the play equipment during recess. They're unsure of the severity of the injury.
How are we going to approach this job? We don't have much training in this area.
At this current point in time, there is minimal information provided for paramedics on the characteristics of autism and how these can pose problems in pre-hospital and emergency department settings. Unlike a cardiac arrest or other medical conditions, there are no clinical practical guidelines to aid paramedics when dealing with patients who have additional needs.
As we aren't specialised in this area, we'll need to assess the situation carefully when we arrive.
The paramedics discuss other ways that they are able to effectively communicate with the patient before arriving on scene. When the paramedics arrive on scene, they are met by the teachers on duty who provide them with essential information about the child, allowing Georgia and Miriam to approach the situation in the correct manner. Teachers inform the paramedics that Max is non-verbal at times and in a very distressed state. The paramedics approach Max, who is crying. Do you think they should A. Yell at Max to stop crying, or B. Try to soothe and comfort Max with strategies provided by his caregivers? Miriam takes the initiative to ask the children who are present at the time of the accident to see if they can provide any further information to assist them with the treatment for Max. The children are very loud and take away the paramedics' attention from Max, who is becoming more distressed. Thankfully, the bell goes and the children return to class.
Hi Max, I'm Georgia. I'll be looking after you today. Can you tell me what happened?
Max doesn't respond or provide any further information. The paramedics need to work to gain Max's trust as he is nervous and reluctant. Individuals with autism can often face multiple difficulties in speech, actions, and sensory behaviour. As a result, paramedics may encounter difficulties in gathering important information about patients which may compromise their care. In order to make Max comfortable, Georgia tries to identify ways to relieve his stress. She notices he is holding a teddy bear.
That's a cool teddy, Max. I have a teddy bear too. Its name is Patches. Did your teddy hurt itself in the fall? Can you show me where your teddy is hurt?
By relating to Max about his teddy bear, he relaxes and calms down. He provides information on his injuries by pointing to his teddy bear's arm. The paramedics also ask Max to point to the numbers in order to indicate his level of pain.
Are you able to point to something to show how much your arm hurts, Max? Point to the number 1 if it doesn't hurt, 5 if it sort of hurts, or 10 if it hurts a lot.
The information provided is insufficient for paramedics to determine the extent of his injury. To overcome this language barrier, the teachers provide Max with his symbol book to aid communication between himself and the paramedics. Max is able to point to the arm symbol in his behaviour aid book, indicating the origin of pain. Paramedics can now confirm that he has injured his arm. Paramedics now need to move Max into the ambulance. The paramedics are now faced with yet another challenge to ensure they can safely transport Max to hospital to receive appropriate treatment. Once again, Georgia and Miriam try to use things that Max is comfortable with, such as his teddy bear. The paramedics approach Max and tell him that his teddy bear is hurt and needs to have a bandage put on his arm as well as go to hospital to be fixed. They ask Max if he wants to come along. The use of his teddy bear enables the paramedics to effectively manage the communication and treatment of their patient.
So your teddy doesn't feel left out. Can we put a bandage on your arm too?
Max indicates that he is okay with this, and so the paramedics prepare him to be transported to hospital.
So why don't we go sit with Teddy in the back of the truck while we go for a drive to fix him? You have to help me in taking care of Teddy.
The paramedics managed to get Max on the stretcher and load him into the ambulance, ready to be transported to hospital for further treatment.
Through overcoming the present barriers within their assessment, the paramedics were able to effectively communicate with Max in order to safely transport him to the hospital, which further facilitates Max's treatment and recovery. This was achieved through building trust and well thought out communication to gain rapport through the use of Max's teddy.
The communication of the level and location of pain experienced by Max was able to be established through the use of his symbol book. This meant that the patient was able to be communicated with in a way that both paramedics and the patient were comfortable with, and meant both parties received the required information.
Situations like these often occur in high pressure and emotionally challenging environments, which add to the complexities of meeting the treatment and transportation needs to the patient. This means that paramedics need to have the ability to think quick and adapt to their surroundings when attending jobs to provide effective treatment to patients on road.